I am very pleased to introduce someone most of us know, Dr. Patricia Tellez-Giron. She's an associate professor in the DFMCH and has a clinical practice at UNGRA. She has been a leader in the Latinx community in Dane County for decades, has been the co-chair for the Latino Health Council in Madison for 20 years, and the medical director and main presenter for a monthly health education Spanish program at La Movida. She's received numerous awards, including the Dane County, Madison, Dr. Martin Luther King Jr. Humanitarian Award, and in March was recognized by Time Magazine as one of the 27 people bridging divides across America for helping to lead the Latinx charge against COVID-19. Thank you so much for joining us today. Very much looking forward to your presentation, Patricia.
Thank you very much. This is the second time that I present, and I'm so happy to present to my family here with the department. So as you see the title of my presentation, I'm going to talk to you about what we have been doing here in Dane County for our own community, and knowing that whatever we do for our community is also going to protect the rest of the wonderful community that we live in. So with that, this will be our main objectives today. So just talking a little bit about the barriers that Latinx communities have in general. We're going to talk about some initiatives that we develop and continue developing as we speak to assist the Latinx community. And then hopefully by the end of the presentation, you could see how grassroots collaborative efforts in communities can really help the communities and be a way to provide care for underrepresented minority communities. We are talking about Latinx today because we are about 18% of the population and the largest minority in the U.S. And I always love to have the millions reflected because sometimes 18% sounds like not too many. But when you see that it's about 60.8 million of people in the United States that are Latinx, I think that is really powerful. The projections are that we're going to keep on growing and we're going to be about 25% of the population by the year 2050. And in general, we are a younger group, although many of the people in our communities are starting to age. And we are also seeing more and more that people are bringing all their family members to live here in the United States, either to help with the kids or because they are missing them. So we're starting to see also a larger segment of our community that is elderly. Even though we are called Latinos, and now you're going to start seeing the term Latinx that I have been using, and we are adopting that term because it's definitely much more inclusive. So we want to reflect that we have obviously females and males, but also a very large segment of our population that are LGBTQ+, and we wanted to also include it in the term Latinos, so that's why we are now Latinx. The majority of us are Mexican American, but we are also very diverse, and particularly here in Dane County, we have people from many different countries in Latin America. We have some common language and cultural values, although each country has very different language that we use for different things. And it's always fun when I see my patients and they educate me on what a term means in their country. And because they have friends that are Mexican, they are good at telling me this is how you say it in Mexico. So they translate for me, and then I learn and I can use the language with other patients that are from the same country. And we are going to have a lot of challenges that we are already seeing, but obviously as the community is growing, we're going to see this even more. When we started learning about COVID, immediately we started getting very concerned about our community because, as you're going to see next, we already had a lot of health disparities, and we knew that because of those and the kind of jobs that we do, that we were going to be hit hard with the virus. And now we have seen that indeed that's what has been happening. When the pandemic started, we started seeing, as you can see in this heading, that it was about a third of the cases that were positive with COVID were from Latinx origin. At some point, it was 50%. And now we are about 18% of the positives. However, we are only 7% of the population here in the state. So definitely disproportionate compared to the population. We know that there is evidence of racial and ethnic disparities that have been documented on several studies that have done, and that despite, if you account for other comorbidities and age, even education or economical status, that those disparities are still present. Specifically for Latinx, we have a higher incidence of obesity in our children, diabetes, high rates of teen pregnancy, STIs, and also depression in adolescents. And over time, we have had the first rate of suicide in adolescents. So this is very concerning. And we know that some of these disparities come with specific reasons that we have in our communities. So we still nationwide, we have about what we know, 14 to 15 millions of Latinx that are undocumented. And here in Dane County, we definitely have still a very large percentage of the Latinx community that is undocumented. And being undocumented comes with a lot of issues. So regarding housing, we know that we still have families that have to be living together, and sometimes you have families that are 10 to 15 in a house. And when you think about COVID and quarantine and isolation, how challenging it is for some families to really be able to fulfill the requirements. The healthcare access, so many of our families are uninsured and do not have access to primary care. Talking about employment, even before the pandemic, we were already experiencing a lot of discrimination and abuse by some employers. And now with the pandemic, this has grown enormously, and many of the employees have not given our community the required measures to protect themselves. And you probably heard of Brown County, where in the meat packing factories and in other factories, they had several outbreaks. Many of our families already live in a fear of deportation and family separation. And even before, again, the pandemic, this was a big issue. With the pandemic coming, several of our members were afraid to even seek care. And obviously, by not seeking care, they are getting sicker. And also, by not seeking diagnosis, they are also going out and probably infecting other people in the community. We have a higher rate of people that are in the lower education level. And, we have a lot of things to account for that. Language, which is one of the very, very important people to access care. As you see in here, in the United States, there are about 52 millions of people that spoke a different language. And from those 52 millions, 32 millions speak Spanish. We don't have a lot of bilingual and bicultural staff, and we know that research has shown that when you have a provider that looks like you, that speaks your language, that understands your culture, that gives you better health outcomes. We have some lack of services, and locally here in Dane County, again, through the different advocacy things that we have been able to do in the community, we have established a very good interpreting services, either in person or by phone or iPad. So that has helped us a lot. We don't have a lot of Latinx health professionals, which I'm working already on it with the mentoring that I'm doing. And now the department is also starting a different project for this. Many people that come to the United States do not know the system, and many also have a distrust in the system because of immigration and other issues. And then, as I mentioned before, we have a very high rate of people that are uninsured. And then particularly for Wisconsin, transportation is really, really important if you're going to make it to a clinic and other services. When COVID comes, then I was telling you that so that we can now put it together with COVID. And obviously the previous disparities that I was talking about are still present, and obviously with COVID got exacerbated even more. Together with this, we are overrepresented in essential jobs like medical facilities and cleaning, the hospitality industry, food. And there are jobs, obviously these jobs are not possible to be done from home. So many of the members of our community were forced into going out despite having a fear of the virus. They had even more fears about not being able to pay their rent or feed their families. Not going to work and being fired for not coming to work. So as resilient as our communities are, they decided to continue going out to work, but that has come with a price. Due to the higher level of poverty that we have, we also, with our population that is undocumented, they cannot benefit from the usual social safety nets that others have been taken advantage of, like unemployment or the stimuli checks. Even if they are sick or they know that they are infected, sometimes they just have to continue working. And unfortunately, the current system, with some exceptions, did not provide to us with culturally and linguistically support for education, testing, and surveillance. So unfortunately, again, when we saw this coming, we knew that probably we were not going to be the first community that the community at large will come and say, how can we help you? How can we fulfill the needs of your community with this crisis? Because we know that this crisis was something unexpected and that nobody in the beginning knew what to do in general, but particularly we realized that over time, we have not been one of the communities that has been really in the radar, and that historically we have had to be the ones providing for our own. So with that knowledge, we also knew that our communities are very resilient. To me, it's just amazing to hear the stories that I hear over and over from the people that I serve about how they made it to the United States. So sometimes when I think about it, sometimes I get a little bit frustrated about people not understanding what we are going through. But then I catch myself remembering that if you came walking all the way from Honduras, Nicaragua, Guatemala, and you knew you were risking your life and that, things could happen on the way. I don't know that the fear about a virus was going to be really high in your list. So I think overall it has been amazing to see that people are really surviving with very little that they have, and again, still going out to work and doing what they need to do for their families. We have some traditional health habits that are also protective for our communities. We have very strong family and social networks. However, that has been really attacked by this virus because it has been very difficult for us not to be able to get the support from our extended families. The fact that if you have to go into the hospital, you are by yourself. And I cannot imagine how frightening that is for people not to speak the language and not to have a family member there supporting them. I can share with you that even me, I'm 52, I'm a physician, and I still, when I go to the doctor, usually my mom comes with me, and it's just a traditional habit that we have, and now that has been really attacked by the virus. And that family support, I think the emotional support for all of us, but particularly for the Latinx, I think is really having an impact on how families are recovering. It is good that we're willing to adapt to any employment opportunity because, again, with COVID, many of our families are still working, but obviously working under conditions that are not optimal. And then, thank God that we had our grassroots community organizations to be able to organize and provide care for our community. So these organizations are reflected on this slide. So 28 years ago or so, when I moved to Madison, we had very little support and organizations that were working with the community. And over 28 years, we have been able to really put together all the support that we have. We started with the Latino Support Network, which is the mother organization, we call it. And then from there, we started dividing to see what the needs of the community were. So the Latino Health Council was actually one of the first organizations that was formed. And then all of the other organizations that you can see. We have the support of the Spanish media and then the community organizations such as True Hispano, Centro Guadalupe, Unidos, Academia Latina, the Latino Chamber of Commerce, the Latino Professional Association, our faith-based organizations. The department has definitely been one of our main supporters and partners through giving me support and time to be able to continue doing my community work. And then Access Community Health Center, that is one of the main places where our community is seeking medical care. So thank you. I think Ken is on this call, and thank you, Ken, for your amazing leadership. So Latino Health Council, our mission is to promote and support the health and well-being of the Latino community through education, advocacy, consulting, and networking. And recently, we also added the mentoring part because we're also working with the pipeline. Before COVID, those are the community activities that we have been doing for many, many years to fulfill some of the needs of our communities. And particularly one that has been amazing through COVID has been the radio program that we have And we are entering our 17th season, and has been again amazing to be able to give education that is language and culturally appropriate to our communities. So COVID hits, and we know that one of the first needs that our community are going to have is going to be money. So the Latino Consortium for Action is an organization that has representatives of each of these organizations that I mentioned before. And we meet once a month. Actually, our meeting is coming this Saturday. And we talk about global issues that are going on in the community and how to support the different organizations. So right away, I remember clearly a meeting was called. We started meeting, and from there, we started meeting basically every Thursday morning for several months. But one of the first activities that we did was to start raising money. And the University of Wisconsin Hospital and Clinics, with our representative Shiva Vidarsilaf, that is basically our angel on many levels, started working with us, and we were the first. The university was the first to donate money into this fund. We also work with the Boys and Girls Club, and they also donated to this fund. And after, I'm going to say maybe a month or so, we were able to raise over $1 million. We opened the application for families, and in the second day of opening this, we had 2,000 families that were applying for this. Within all these organizations that I presented before, we got volunteers that got organized to start screening the families. And one of the criteria was that it was undocumented individuals and small businesses, because we knew that other individuals will benefit from the stimuli and with unemployment and other things. So we wanted to be able to serve the ones that were in most need. At the same time, we knew that we needed to start educating our communities about what this virus was about, how to protect their families, and obviously with this, protecting the community at large. So we started doing right away. I remember the first radio program that we did that was supposed to be for 2 hours, and we went into 3 hours because we had a lot of questions with the audience. And from there, I have done, I'm going to say, at least 20 other programs and some in national television that we talk about raising awareness. And then we started activating the media that we already had with Facebook. And now we are basically on every media that you can think of. And we're going to talk a little bit more about that. And then as we go realizing what other needs are there. And one of the first ones that we recognize is that the youth was not really protecting themselves. So we started doing a youth education campaign where I recruited my pre-med students, my med students, and my high school students to be our consultants. And one of the very first things we did a rap song about masks and protecting yourselves and washing your hands and keeping the distance. That was really a hit in our youth. And from there, we have been producing other information that is directed to the youth. And then we started doing again much more promotion about this, and then getting information that was reliable, videos that I started producing about information on how to take care of yourself, the importance of testing, etc. And then as we went now, as things keep on progressing, we started realizing what other needs we had, and now I started a series of forums in Facebook Live. The first one was with the elderly and talking about their experience through all this several months of having to stay home and how their families are protecting them and what advice they had for our community. So we wanted to elevate the voice of our elderly so that other people will also listen to their advice. And then this Monday, we had the second one that was listening to personal stories with COVID from real patients so that we can also give a voice to the patients that we have many people in our community now that has been affected by COVID. And for the audience to listen to them, not to me, telling them what this is about. I thought that will be much more effective. And the next forum that we are planning is about vaccines. And we already had our first radio program talking about vaccines because we know that many people in our community are going to be reluctant or have questions about the vaccine. And we really want people to know that it's safe and that what possible side effects and to answer all their questions. I'm going to be presenting also in some churches and, doing more with the vaccine. So at the same time that we were trying to do all of this, we started seeing that mental health was one of the main things that people were very scared and stressed about it. And we created a general strategy where we use motivational and educational videos that were locally produced. So we will see what the needs were with community resources. And then we had people that were very well known in the community, like Marta Saucedo, that has been an angel with Access Community Health Center. And again, thank you, Ken, for allowing her to participate with us. And what we did is that we started identifying that many of the people that she was working with were actually patients with us at Wingra or Access. And then she was able to continue providing ongoing mental health care for our families. So that has been amazing. We have been producing about 2 videos per week. So we have a very large collection right now of videos that we are housing in YouTube, in our YouTube page, but also we are switching them and making them circulate in our other media. And then we needed to have an individual strategy. So we got together a group of volunteer mental health providers and others in the community. And then through the different organizations that I presented before, we started getting referrals for people that needed individual services. And we provided care for the first 3 months or so for over 500 individuals. One of the strategies that worked very well was my mother, who was working for many years with the elderly, and now she's part of the group where the elderly has different activities. She took it on her own initially, and then with my direction to start a rotation with the elderly. So she has 2 or 3 other elderly, and she divides all the people that we have in the elderly support group, and they check on them at least once a week to give them emotional support, but also to see if they have any other needs like food, cleaning supplies, hygiene supplies, things like that. And that strategy is still ongoing and very successful. For the general population, we are now partnering with another organization that is working with us. And then as the pandemic was happening and we started having a lot of members that were COVID positive, we started offering also emotional support for COVID positive patients and families or participants that were waiting for their results and were very stressed about that. And then as we realized that also with kids having virtual learning, parents also needed some support. We started providing parental and other family member support. And I say other family members because many times it is grandparents that are providing this support at home for the kids as parents have to go out and work. So we started using some flyers that we were distributing in all the Latinx owned businesses and all these different organizations so that it will be easy for them just to give them those little flyers. And now through Project Recovery, that is the one that is providing this service currently, we are partnering with them to continue doing this activity. And then at the same time, again, all this happening together. So a lot of work and very busy for several months. We started advocating with Public Health Madison, explaining to them the particular needs of our community and how we needed to have a testing site where people will go and get information and education about this in Spanish, and that they could also talk to them about the community services that we were offering. So we worked with them and we had many meetings until finally we were able to have our COVID testing site open right here in the south side of Madison. One of the challenges that they were talking to us about is having enough bilingual, bicultural personnel. So we said, don't worry about that. If you allow us, we will recruit for you. So I took into recruiting 18 members of our community that were bilingual and bicultural. And then we were able to have them start working with Public Health Madison and Dane County. And they are still working there. Many of them are my students that are in pre-med, that this was a great opportunity for them to make money because they needed money anyway, but also to learn about public health and community health. And I have been mentoring them through this experience as well. And we still have this testing site that is available for our community currently, and we're hoping that it's going to stay until we really need it for the future. Another thing that was recognized that was needed was to educate the Latinx-owned businesses because they were still not following some of the recommendations, and obviously people that were coming to this were not following the recommendations either. So we were able to get about 10,000 masks from the Public Health Madison, and then we started producing our own materials and also taking some materials from the CDC that were very good. I will read them and I will make sure that the information was reliable and cultural and language appropriate. And then we will print several of these posters. I think every time we print them is about 1 to 200. And then we will have a team that will distribute these posters on the different Latinx owned businesses. And in the beginning, they were very reluctant to do this because they didn't want to lose customers. But then when the orders came from Public Health, they were actually looking for us and asking us for the mask and the materials to be able to have them for their businesses. And then extending that to the community-owned the community grassroots organizations, we also started partnering with them so that they could distribute this information to the people that they were serving. And we have been partnering with the Latino Chamber of Commerce and the Latino Children's and Family Council, and they have been amazing partners on distributing this. Now we have centralized this to the Latino Chamber of Commerce, so we are distributing this information everywhere so that if families need more information or need masks, they can go to the Latino Chamber of Commerce and just ask for how many they need and what other resources they need. So it has been a very nice collaboration. So this is, in a summary, a little bit of what we have been doing. And as I say, we are continuing doing this now with the vaccines. And then as we go, whatever needs we recognize, we keep on going with this. But we know that for the future, we are hoping that the community at large will understand the needs that we have and that we have better data collection to be able to justify the needs that we have in our communities. We are definitely in need of increasing the number of Latinx professionals in healthcare. And again, we are already working with different organizations at the university, at the high school level, at medical school and residencies. So, and now with our department that we are starting to do a project as well. And we need to have more advocacy to improve and increase services for our communities. I think our communities have been in the shadows for too long. And we need to bring visibility to our communities for a good reason. I think there has been a lot in the media over the past 4 years that has been very negative towards our communities. So I think it's time to have the community at large understand our needs and understand the value that we bring to this community and how we are here to provide for all of us, not only for the Latinx community, but for everyone in our communities. And that is where it comes, the last part of this, that is the more collaboration among other at-large community organizations. And that's what I have for you today. So let me stop sharing, and then we can go into our questions.
All right, wonderful. Thank you so much. Just blown away by all that you've done over these past few months. Just outstanding. For the questions, please write your question in chat, or if you want to come off mute and just put question mark in chat, and I'll call on you in order if you want to say it personally. So Patricia, just a couple quick questions. One, will a copy of the PowerPoints, will you make that available for participants?
I will be happy to share it with anyone that needs it. I can send it to you, Melissa, and then you can just have it available.
Perfect, thank you. Going back to health access, I was curious, thinking about telemedicine and the wrapping up. It was I guess a couple questions. One, were there barriers, and was that an accepted form of health delivery?
Again, with my community, I am always so impressed of the resilience of our community. When we started doing telemed, I had my doubts, like, oh my goodness, I don't know if people are going to be happy with this, because obviously the personal touch is really important for our community. But it has been amazing how the community has adapted to doing video and telemed. And now it's like anything else, even for our elderly. And interestingly enough, the elderly adapted to this even faster. My mom's group is meeting over Zoom. And it's just amazing how they help each other, how they know how to access these. So again, very, very resilient.
Great. This is a question from Jennifer Adus. First, thank you very much, and very inspiring. How has the academic medical center supported your amazing work over the years?
Well, I can tell you that the department has been very, very supportive from the beginning. I mean, to a point that sometimes if I need to make copies for some of my events, I have been allowed to make copies at my clinic. And over the years, obviously, I have had very, very good mentors. I know John Fry is watching this. Thank you so much for everything that you taught me from the beginning. And Ken Kushner and Dick Anstead, they were amazing mentors for me with the department. But in general, all of my partners here at WINGRA are always supporting me, like they come to the radio program. Beth was one of the main supporters of the work that I do in the community and coming to the program. So that has been really good. The medical school does pay very little of my time compared to the time that I need, but at least I get some time from there to do. So yeah, I think in general, I have felt very supported. That it could be better, definitely, because with all the different roles that I have on mentoring and working for the community, I could use a little bit more time. But I think in general, I have felt supported.
Great. And Bruce Barrett, if you want to come off mute and ask your question.
My question is around, I think, the concept of allyship. This year with Black Lives Matter, many very good things have happened. Many people have been energized and lots of movements have started. But I've had, this nagging about, how do Latinx people and Native American people and other repressed minorities feel, and how can we take those feelings and transform them into better action kind of together? And, especially as privileged white folks too, so what are your thoughts on allyship and on Black Lives Matter and so on?
Yeah, definitely. And I can see the question from John Fry about sharing all of this with other communities. And I think the consistent issue for me has been time, right? Because in order for me to be able to share this at the national level or to publish or to share it with other communities, I need time to make those kind of connections. And I think for minority communities, that is the issue, that we are not given enough time or enough resources to be able to really do this in a greater scale. I think if we will have those resources and the time and all that, we could really do even more connections with the community at large and with other communities within the state and even nationwide. So I think there is an idea for our leadership to maybe provide a little bit more of this time and resources for us to be able to link with other people, because I have talked to people from other communities, and it's the same issue that, you have one or two representatives from that community that are doing all this job, and it's not possible to provide for a population that is so large with just having one or two people.
Great. Yeah, and along the lines of John's question, thinking about coordinated efforts across the state, and I was thinking like the Brown County, the meat packing plants and the spikes that have occurred there, also across Iowa and the Midwest. Are there coordinated efforts to help with these outbreaks?
Yeah, so we are willing to share everything that we have. We have been promoting this again in different venues. And obviously Facebook you can access it from anywhere, right? Mm-hmm. And our radio programs, you can access it from anywhere through the YouTube channel that we have. It is just creating the relationships between the main leadership. And unfortunately, in some parts of Wisconsin, there are not any organizations similar to the ones that we have here. Actually, what we have here in Dane County is very unique. What I presented with all the different organizations that we got together. We have talked to people even in Milwaukee. They don't have the same level of organization that we have. Green Bay. It has been difficult to really connect to people there. I am working actually with an influencer in Milwaukee that is sharing all the materials that we have for care page in Milwaukee. But that's one of, only that we have connections with. So I definitely invite people in the audience that if you have any connections with other organizations in the state, we definitely will be able to share. We want people to get these materials and to learn from what we did here.
Exactly. And John also put, possibly working with UW Extension or that might be another venue.
Yeah, again, over the years, it has been difficult to establish networking with other places because some places, again, they don't even have a venue. So it's not that that we don't want to share, but when you ask, they don't have something similar like a radio program or media or an organization that is directly working with Latinx, which is very sad because at least here in Dane County, we have all of these. But in Wisconsin, in general, in other places, they don't have anything.
Right. Yeah, that's. How can people that want to support the fund? How can we?
Yeah, so the fund, I'm not sure if it's officially closed as the fund is, but we are still asking people to contribute to the different organizations that I presented.
Mhm.
So Centro Hispano, Unidos, Academia Latina, Latino Health Council, obviously, we are always welcoming donations to be able to support the work that we are doing. We got a small grant through the partnership with one of our collaborators, Dr. Maria Mora, that is also a fellow with the department. And she got a small grant for the media part that we are doing. And then we got also some resources with Public Health Madison that we used to pay some of the efforts of the collaborators, and then we gave some to the agencies that I mentioned. But there's always need, right? And after the pandemic, which we don't know when this is going to be over, the needs were still there present even before this. The organizations were really suffering for funding.
Can you elaborate more on the vaccine hesitancy, the reluctance issue in the Latinx community?
Yes. So there is still a lot of misinformation in the community and a lot of mistrust in the system because of obvious reasons, as I presented before. But what is good is that we have established a very good reputation through Latino Health Council, so people know who we are. They trust our advice. They know that we are trying to do what is best for them. So that's why we are starting to do this like as much as we can. We're going to use very similar strategies that the ones that I presented. So we're going to go on the radio. We're already doing that. We're going to have forums. We're going to do posters that we're going to put on the Latinx owned businesses with frequent questions and saying it's good to get the vaccine. And if you have questions, you can go to our website and look at the information. Because we know that's going to be a barrier, definitely. I mean, we have several members that didn't even want to do the flu shot, and we have been kind of talking to them about the importance of the flu shot, which was another intervention that we did. And then one-on-one, I already, with every patient that I'm seeing in the clinic, I'm talking about the vaccine, which is taking a little bit longer for my visits, as it usually happens, because I have to do a lot of education first about COVID and prevention. And now I'm doing about COVID prevention and vaccine so that they can go back home and also talk to other people at home. But we know that is needed and that is going to take some time for us to do it.
Definitely. All right. If anyone else has a question, I'll give you a few seconds to either put it in chat or let us know. All right. Well, thank you very much. Just outstanding work you're doing, and I'm so glad you're able to share. And it's an amazing example of getting people together and doing such amazing work in a short time because of you and your role in the community and your leadership. You made it happen. So thank you very much.
Yeah, and thank you to everyone again that has supported us over the years. And hopefully, my goal with doing this kind of presentations is again to bring light again in our community. Many people don't know that we have been here for over 100 years, with the migrant workers. And then we have a lot of families that settle here and that have been here for a very, very, very long time. And still sometimes I get there are Latinx in Wisconsin, and I just go like, okay, where do I start, right? So I'm really hoping that with this, we can start talking more about the Latinx needs and start working on how we can fulfill the needs and the health disparities that we have. So each of you in the audience are vectors for education. On every place that you go, you can advocate for our communities, because I think it's with the help of all of you that we can do it. We cannot do it just with one or two of us. We need everyone to really help us. So thank you for inviting me.
All right. Well, our next forum will be in January, and notice will be going out shortly. Thank you, everyone. Have a great afternoon.
Thank you, Melissa. Bye.